I'm Sang Hyuk-lee. I'm Senior Fellow at the US Center and Professor and Chair of Economics at the University of Hawaii. And it's my pleasure to have this seminar. So the seminar is about Hawaii's growing elderly population. Hawaii's elderly population is growing, which poses new challenges such as an increasing need for social protection and home and community-based services. So the current coronavirus pandemic is likely to exacerbate this impact of population aging. So this is actually very time relevant. So we'll have 3 presentations today, followed by discussion. So let me introduce the presenters and discussants very briefly. So Dr. Andrew Mason will give 2 presentations. So he is a senior fellow at the US Center and emeritus professor of economics at the University of Hawaii and Manoa. And he's a founding director of the National Transfer of Crowns project involving researchers from more than 70 countries. And Dr. Catherine Brown is professor of public health and social work at the University of Hawaii and Manoa, and she's a principal investigator of Ha'Kupuna National Resource Center for Native Hawaiian Elders and co-investigator on a number of other projects to support translational research to reduce health disparities. And we have 2 excellent discussants. One is Dr. Yang-Sung Kim. She is a research and statistics officer from Department of Business, Economic Development, and Tourism State of Hawaii, so-called DBED. And another discussant is Dr. Colleen Hayashida. She is a graduate faculty in sociology, University of Hawaii and Manoa. So I would like to mention that this forum, this seminar is sponsored by the DBED of State of Hawaii and hosted by US Center. So without any further ado, let's get started. So, and this presentation will go first.
Hi, thanks for joining today. So there are many important issues that are naturally addressed from a generational perspective. How much should we spend on our children's education? Should we devote more resources to Medicare and Social Security? How much should people be saving up for their retirement? These are just a few examples. There are many more. Later, I would like to talk about these issues in light of an important coming storm, population aging. But first, I want to talk about COVID-19 from a generational perspective. So COVID-19 is having a huge impact on how much we are producing in Hawaii. We have record levels of unemployment and underemployment. Many businesses are shuttered, and many others are operating well below capacity. This is leading to a sharp drop in labor income and asset income, which together constitute what we call primary income. Working age adults will suffer, and so will retirees to some extent, because they depend on asset income. Now, there are many people, children and some retirees, who are not heavily involved in the productive side of the economy. Their prospects during a recession will depend on a web of transfer systems that provide for their support. Children will depend on families, but also on state and local governments that fund public education. Seniors will depend on federal programs like Medicare and Social Security to maintain their standards of living. So in this talk, I want to show how resources and how, hence, economic vulnerability vary across age, relying on baseline data for Hawaii compiled for 2012. Let me share now. The data rely on a generational perspective pioneered by the National Transfer Accounts Project that now includes research teams in more than 70 countries around the world. These accounts document how people at every age acquire and use economic resources to meet their material needs, to help others, and to provide for the future. The Hawaii Project is a collaboration between the East West Center and the Department of Business, Economic Development, and Tourism, to which many people have contributed. We'll have more detailed information on our website, and this is the URL that will take you there. So let's begin with labor income, which is fundamental to our economy. We estimate the labor income composes about 71% of primary income in 2012. But what does the age pattern of labor income look like? Well, we show this in the upper panel, which is per capita labor income. It peaks at age 53 at about $60,000. Note that it is very low at older ages, of course, and it is zero when we get to young people and children, rather. Below, we can see how much labor income funds consumption. So between the ages of 26 and 62, it funds more, it provides more than enough to pay for consumption. While at older ages or younger ages, it does not. So we also can look at primary income, including asset income with labor income. And we can see the picture changes somewhat significantly. Now, especially at older ages, we see higher income and a higher percentage of consumption that is being funded. So now even people up to age 68 are having all of their consumption funded by labor income and asset income, about half up to age 83, and only beyond that is less than half funded by primary income. But children don't benefit from primary income at all. They don't really receive any. So how do children get along? Well, they depend on transfers. So if we look at the sources of income, including private transfers, we can see that children are funding about, getting about $18,000, $17,000 a year from private transfers. That's family support for the most part. And this funds about half of their consumption. There's no free lunch here, though. Some of this is provided by parents, of course. So we have negative values for people who are older than age 25. The peak is at age 46 or so, $16,000 a year. And of course, this is people with teenagers. And we see a little bit provided by grandparents. So age 63, well, it's not inconsequential. It's an average of about $5,000 a year. Now, for the most part, seniors don't really receive anything from private transfers. They're giving as much as they're getting. If we get to very old ages, so in the somewhat old ages in the 80s, we see that private transfers are not inconsequential. They're about $1,000 or so. So then with the final piece of the puzzle is public transfer. So let's turn to that. And we want to distinguish, it's important to distinguish state and local programs from federal programs. So when we look at state and local programs, we see those here. All of the inflows, net inflows, are going to children. So they range as high as around $10,000 a year. A lot of this is funding public education. We can also see where it comes from. It's not from parents. It's coming, maybe partly it is, but it's coming from taxpayers in general. And a lot of it comes from older adults. Now, the public programs are very different. Those fund old age needs, And we can see large public transfers that rise to around $26,000 a year for people 85 and older. And these are funded heavily by people in the working ages. So when we put all of these together, we can see that these resources are funding all of consumption, except for two small intervals between ages 20 and 26, 27. Consumption is also being funded by debt. So people are borrowing student loans, credit card debt. And then when we look at very old ages, 83 and above, we see people are drawing down pension funds essentially to fund their consumption. Now at these middle ages, people are actually saving. So we see then that the generational distribution of resources will surely have a large impact on how the COVID-19 recession plays out from a generational perspective. Both young adults and children are very vulnerable because they depend so heavily on labor income or on their parents who depend heavily on labor income. In addition, children depend on resources provided by state and local governments, which will surely be adversely affected by the recession. The situation is very different for older adults and for seniors. Older adults, I mean working age adults, do depend on labor income. But they also have asset income, and that may cushion the blow from the COVID-19 recession. Seniors depend heavily on public transfers, and at least in the short run, these are clearly more recession-proof than other sources of income. So in the next talk, when we turn to aging, we'll see a very different way in which resource allocations are going to play out. And seniors in particular are going to be highly vulnerable to the impact of aging. Okay, thank you very much.
Okay, thank you, Andy. Sorry, everybody is muted except for me, so you cannot hear this big round of applause. Okay, for many people, this methodology, I mean, you're not probably familiar with this methodology. So, it's based on some methodology so-called national transfer accounts. I mean, by the way, there are actually, we have participants from this research network and also participants from Hawaii. So this methodology describes the age patterns of economic activity and the economic relations between the generations and quantifies how each age group acquires and uses economic resources. So it uses, construct using existing data. And to my best knowledge, this is the first time that we constructed this one for just one state. So we have constructed this for country level, but constructing it at a state level and local level it turned out to be much more difficult. So Andy complained a couple of times that this is actually 3 times more work than he expected initially. So again, thank you very much, Andy. And let's go to your next presentation.
Hi. So I want to talk about aging and Hawaii's economy. This is work with Michael Brigo. A lot of others have helped. We're going to rely heavily on our representation of Hawaii's generational economy based on data for 2012. So in the upper left-hand panel here, we see 2 profiles. One is consumption and the other is labor income. These are per capita values by age. And the difference between the two is called the life cycle deficit. And so this is the amount that is not funded by labor income and has to be funded in some other way. So it's quite large for seniors, for example. Now, the different ways that we are funding the deficit in Hawaii are shown in this lower panel. And if we look at seniors, we see that mostly it is public transfers and assets like pensions and so forth that are funding the deficit. And for children, it is mostly public transfers, particularly public education and private transfers. Now, the other panels on the right-hand side are aggregate values. So these are in millions of dollars. So one is 1 billion, 1K is $1 billion. And these are calculated by using population times per capita profiles. And so this presents us with a simple way of looking at aging. We can talk about what if the per capita profiles remain constant, but population changes in the ways that we expect as projected by DBED and extended by us to 2060. So if we look at the next figure, we can see the values for 2020. We'll just look at consumption and labor income in the upper panel, and in the lower panel, look at the life cycle gap. This is for 2020. Now we can project this forward, and the biggest changes are here in the size of the life cycle deficit at older ages. There's not much change for working age adults or for children. Let's look at this again using the total values by year. So for 2020, we have consumption and labor income. And the gap in this year, we estimate to be $9.5 billion. It has to be funded in some fashion. It's a big increase from 2010 when it was only $6.5 billion. And we can look forward to another big increase between 2020 and 2035 and continued rises to 2060. All told, the gap is going to be, I don't know, $7.6 billion or so increase by 2060. So what can we do about that? Well, there are a number of possibilities. One possibility is that we can just accept lower standards of living. We can say, well, we're living longer, and so we're just going to have to consume less in each year, each age. If we took that option, we would have to reduce consumption at all ages by almost 12% between 2020 and 2060. We could work harder. So labor income would have to go up by 16%. So a lot of people are already working hard, so this is not very attractive, as is lower consumption isn't either. But we could also do things like raise labor productivity through more education or eliminating barriers that exist in our society. A third option would be to accumulate more assets. So we could save more for retirement during our working ages and rely more on those in the future. Asset income would have to go up by almost 70% in order this to fill a $7.6 billion hole. So this is a big challenge. And then finally, we can kick the can down the road. That's been a favorite option for years. So we could just accumulate public debt. Well, that's not very attractive. It's not clear we can continue to do that indefinitely, and it just burdens future generations. So anyway, those are the possibilities. Fortunately, we can rely on some combination of them, and hopefully that'll be more acceptable for us. Now, I don't have very much longer to talk, but I want to be sure about a few things. One is that aging is an immediate problem. So the annual deficit is going to be higher in 15 years by almost $5 billion. Secondly, most of that increase is going to be visited on seniors, people 71 or older, so 94% of the increase. And so we need policies that not only affect, deal with the big macro picture, but we also have to deal with the picture with respect to seniors especially. And so there are a number of possibilities. We could improve employment opportunities and productivity for seniors. We could increase it for everybody, of course, and that would allow us to support public programs for seniors better. We could slow growth in healthcare costs without sacrificing quality. We could create a better environment for retirement savings. So that might be saving programs, may also be a better macro environment that where interest rates were higher and returns to retirement savings were greater. We can mobilize public support for federal programs like Medicare and Social Security. That's a national decision, but people in Hawaii can certainly lend their voice to strengthening those programs. And then finally, we can, of course, strengthen programs for seniors at the state and local level. Now, I want to be clear that a lot of more resources go to seniors from federal programs than from state and local programs. So state and local programs, however, are meeting some critical needs, and they can certainly do more of that and do it more effectively. And that would be very valuable as we deal with aging over the next 15, 25 years. So let me just say a final word. I hope people will use these data to look at aging issues in more detail. It may not be clear, but we've been working on these for over 6 months. We've analyzed endless surveys, macroeconomic data, administrative data, to make sure that what we're doing is accurate and also consistent with what other agencies are saying about the Hawaiian economy. Another point I want to make is that we have followed technical guidelines that have been vetted by UN agencies and many others. So we're quite confident in the procedures that we are using. I also want to mention that there are many things about the economy that we don't talk about here. So for every data series I have shown, there are 4 or 5 or 6 underlying series, different elements of consumption or public transfers or state versus federal transfer programs, taxes and different kinds of taxes and so forth. So I hope you'll look at our website and use those in your own work. Thank you.
Thank you very much, Andy. Again. Okay. So Andy gave us a multiple choice question, how to fill this 7.6 billion hole. And my choice is accumulate more asset because I don't want to lower my standard of living. You know, I'm spoiled. So, okay. Without any further ado, let's move on to Catherine Brown's presentation. Catherine.
Aloha, this is Catherine Braun from Public Health and Social Work. So Andy, that was very, very cool. And I'm very much an admirer of your ability to take all that data and to come up with something so cogent. I'm gonna take a little different tact here and talk about Hawaii's multicultural elder population and who we have here and how that might influence these private transfers as we go forward. So many of you from Hawaii already know that Hawaii was first inhabited at least 1,000 years ago, about 1,000 years ago, discovered by Captain Cook, visited by whalers and colonized by missionaries. And many of the first people, the the native Hawaiians died off because of many foreign diseases that were brought by these colonizers. Therefore, we had a huge immigration for agriculture. And these are pictures of some of the people who came from China, from Japan, from the Philippines. And the man on the horse is from Portugal, imported to be a manager over these laborers from Asia. There are a number of waves of immigration, as you can see here in the numbers and the years, including now most recently people of Mexican origin that have come in for agriculture. A lot of other immigration triggers have shaped our multicultural population. The Chinese Exclusion Act, the overthrow and annexation by the US, the Spanish-American War, and the Treaty of Berlin, through which we got control of the Philippines, Puerto Rico, and American Samoa. War Brides Act, so a lot of soldiers bringing brides from Asia and Germany and France, and 46 US got control of the territories and the islands in the US that we now call the US affiliated Pacific. So immigration from there. Statehood, of course, brought a lot of people from the continental US, draw from Vietnam. And even today we have 37,000 active duty military that contribute to our chop suey cultural environment here. So the ethnic distribution today is varied, and many of you already know this, that Hawaiians, Caucasians, Japanese, Filipinos, Chinese, Korean, Samoan, all these are pictures of friends of mine, except for the actor from Hawaii Five-0. But it is a very, very multicultural society. So in a lot of my work, I try to see what differences there are by ethnic group, including differences in aging and caregiving. So the good news is that Hawaii is a fabulous place to live, and the older people here live longer than they do in their native land. So our Japanese live longer than Japanese in Japan, Chinese live longer than Chinese in China, Filipino, except for Caucasian, I believe. Otherwise, people are living longer here than they do in the places where their ancestors are from, or where they are from, where they were born themselves. But we do have disparities in life expectancy. So when we talk about Hawaii having the longest life expectancy in the country, you can see that a lot of that is contributed to by Chinese, Japanese, and even Filipinos. So this is probably the only place in the country where Caucasians come in fourth, where we're not the top, where we're not like, not everyone says, well, if only I were white, I would have the best health and the most money and the longest life. That's not the case here. Our standards here are the Chinese, Japanese mostly, and the Filipino and Korean are coming up as well too. Now the Filipinos are interesting because often we do think that this paradigm here would be related to, these disparities would be related to socioeconomic status and education, income and education. However, Filipinos tend to have lower education than Caucasians and lower income than Caucasians, but here they are living longer. So wondering about, this is a similar pattern we see with Hispanics in the United States, that even though they have less income and education, they're often healthier or happier or something, and this is called the Hispanic paradigm. So wondering if that's happening here with Filipinos. So now reasons for these differences is something that I've taken time to try to study myself. And of course, we're looking at socioeconomic status. And you can see here, and I'm sorry that my screen is covered by part of the Zoom controls, but blue is Caucasian. No, blue is, I'm sorry, I can't see it. Well, white is black. Okay, so Hawaiian, Caucasian, this must be Filipino. And these are Japanese and Chinese. So you can see that home ownership. I've ordered them in longevity, in order of longevity. So you can see home ownership is fairly correlated with longevity, except among Caucasians. Per capita income is sort of correlated with longevity, except for Caucasians. And household income is also sort of correlated with longevity. Interesting thing here is this household income for Filipinos, for example, and per capita income from Filipinos, suggesting that Filipinos are more likely to live in multi-generational houses or housing with many more people, whereas Caucasians are living in housing with a fewer number of people. Also, Hawaiians are living in housing with many people. So this has implications for caregiving, and probably also has implications for COVID, as those people in more crowded households, and I'm sure if we had the Micronesians on here, they would have also a very data that would suggest that many people are living together in crowded conditions, and it's probably why their incidence of COVID is so high. Another thing that correlates well, but I didn't put the data on this graph, are adverse childhood experiences. So this correlates perfectly actually with longevity. So those cultures, those ethnic groups that have, who have individuals who as children experience lots of adverse childhood events like the death of a parent or substance abuse use or incarceration of a parent or being abused themselves, they have a lower life expectancy than those who as children, those groups in which the children report, the adults report fewer of these incidences in childhood. Another reason could be culture and history with the US and racism. Of course, lifestyle behaviors, which is related to socioeconomic status, and availability, acceptability, and accessibility of healthcare services, which is related to the kind of work you do. Many of people in the Filipino community and the Micronesian community are working multiple jobs, and maybe even if they have health insurance, don't have time to go to the doctor because they're working 16 hours a day or 12 or 14 hours a day. So looking at the aging population in Hawaii, we are the #1 state in the United States in longevity. But as I told you, there are disparities in longevity by ethnic group. We're #8 in the state of the percentage of elders, so the percentage of people over 60. And by 2030, 27% of our population will be over 60 years old, 60 or older. We are the #1 state for elders living with others. We have the fewest number of elders living alone. So there's potential there for more intergenerational transfer of care and wealth. Both ways. We have actually not listed here, but a very high percentage of older adults taking care of grandchildren as guardians, as direct caregivers, and indirectly. And 85% of long-term care in Hawaii is provided to elders by family members. So there's a lot of private transferring going on there. Local values and elder care were very much influenced here by Native Hawaiian and Asian values, the similarities being that families are very strong. And there's, in every culture that we have here, they say that honoring their elders is very, very important. And of course, everyone wants the best for children and grandchildren. But there are differences. In my interviews with Native Hawaiians and Filipinos, there's a very strong feeling that family care is part of life. It's nothing special. I'm not a caregiver. I'm just caring for my disabled husband, my disabled father, my disabled wife. So this is more normal, but also these are the lower income groups and the people more likely to be in multi-generational housing or housing with many people living together. Among the Caucasians and Asians with more money, there's more now of a feeling in my research that you need to care for yourself as an elder. You don't want to burden your children, and that there are many more options now for older people that have money to go into retirement facilities or assisted living facilities, so that when we look at elder care, I usually order it in the order of cost. So provided by family. Of course, there's a lot of costs that maybe aren't monetary or aren't monetized within the family, but it is the cheapest to public transfer systems. And then there's care provided in small care homes and foster homes, and many of these are Medicaid funded. So for low-income seniors, they can be cared for in these homes. And in fact, operating these facilities has really helped the Filipino community become homeowners, because then it allows them to have multiple people in their home and extra income from providing that care. And then more and more care is being provided in assisted living and retirement homes, as we see places like the Plaza, Kahalanui, spring up, where 20 years ago, 30 years ago, we didn't have any facilities like that except Arcadia. But these now, they're expanding in Hawaii and offer many, many more options for care. So the implications for intergenerational transfers in Hawaii, we do have a high cost of living and education, which I think will promote more intergenerational households and exchange. We have a super high cost of housing, which will increase the need for direct and indirect assistance from families to younger people. And local values and small geography, I think, will support more co-housing and intergenerational exchange. I didn't see that as an option in Andy's list, but I think we will see more co-housing happening here in Hawaii as a result of the high costs and the effects of COVID. Elders with money seem to be choosing more of these retirement and assisted living facilities, so that will eat up assets and potentially reduce intergenerational transfer or money available to go from grandparents to grandchildren as much in the past. So that is my presentation, and I will stop sharing.
Yeah, thank you very much, Catherine. That's very, interesting. It's very interesting actually for me, and it has lots of information. So we have two discussions, and Yang Sun, actually, can you go first?
Okay. Good morning, everyone. I'm Yang Sun from Tibet Research Division. Let me share my file to share. Yeah. So again, this is Yang Sun from Tibet Research Division. Professor Mason, the first presenter, is the world-renowned expert about generational economy. As he said, the generational economy is to see an economy from generational perspective. Some of you may not be familiar with this practice because I was like that. I studied economics at college in 1980s. Back then, I believed that it was totally fine to talk about economy without thinking about population, because population was typically growing, but not much changes in its structure. So no particular impact of a population on economy that we had to care about in analyzing the economy. But actually many economic behaviors are age dependent, especially labor earning and consumption vary significantly by age. So this is a chart I borrowed from Andy's work. According to my reading of Andy and his team's work, their transfer count works were motivated by economic life cycle, which is a fundamental feature of all economies. What it tells you is that the young and the old consume more than they produce through their labor, while the prime age adult produce more than they consume. So people have life cycle deficit when they are young or old, while they have life cycle surplus when they are at prime working age. And the result is large economic flows across age group, which is mediated by family, government, or markets. Now the world population is undergoing profound changes in its age structure, which means a huge change in the size of a group who have a deficit and who have a surplus, and the changes in how transfer and how much transfer across generation to meet demand of each age group. To analyze how we are currently doing all this and to project how they will change and to get prepared for all these changes, a must-have is a good system of age-based economic data. Actually, there are a lot of economic data, as you know. Many of them are very detailed, but they are detailed by sector or by types. But it's true that most of the conventional economic data provide very little information about the age and the generational dimension of economies. So, and this, the National Transfer Account that Andy and his global research team have been working were developed to fill this gap. They reorganized economic data from generational perspective by providing age profile of labor income, consumption, and all the transfers to improve the understanding of the age or generational dimension of economies. So as Andy mentioned, the research team in the National Transfer Account Global Network have constructed or currently constructing the account for more than 70 countries. And as Sangi mentioned, and the Hawaii Transfer Account is the first transfer account constructed at sub-national level. I work for the state government and have been doing research at state or county level. And I know that compared to working at national level, getting data at supranational level are much more difficult. And typically there are a lot more data issues to deal with at supranational level. So I'm sorry to hear that and spend just a lot more than he planned or hoped. But I really appreciate the hard work of Andy and Michael who made this happen. So they built a baseline transfer account for Hawaii using 2012 data and provided a projection to the year 2060 that can be used by researchers and the policymakers to get better prepared for upcoming changes. Then what would be the benefit of constructing Hawaii transfer account in addition to US transfer account they already had built? This is another chart available on National Transfer Account website, which I found very interesting. It shows how old age support system varies by countries. Seniors in the US rely mostly on the public transfer and the saving. Saving which is asset-based reallocation, while the role of family transfer was very minimal. But most Asian countries shows more important role of a family transfer. Then how about Hawaii? Hawaii is a part of the US with the same or similar social and economic system, but it has a very unique in racial composition and the culture, which has well demonstrated in the Professor Brown's presentation. She introduced the history of immigration that has led to the ethnic diversity in Hawaii. And she showed Hawaii has the highest life expectancy in the US, but there is a significant disparity among ethnic groups in life expectancy. And it was discussed that elderly care in Hawaii was strongly influenced by Native Hawaiian and Asian value. We call it local value. But living and the caregiving pattern varies by ethnic groups. So she concluded by providing implication of this local value and high cost of living in Hawaii for intergenerational transfer in Hawaii. If I can add some more statistics characterizing Hawaii population, Professor Brown shared the race composition of Hawaii population, but I believe that that was based on data from State Department of Health, where you can report your race only in one race. This is a race statistic based on data from Census Bureau, which allow you to identify your race in as many as race you want. So it's very detailed. So one fact I would like to point out here is that Hawaii has a large mixed race population. So 2018 estimates show that about a quarter of Hawaii population was at least two race mixed. And with the Native Hawaiian and Asian influence, share of family household is higher in Hawaii than most other US states, only except Utah. And 11% of family household in Hawaii was multi-generational household, where at least 3 generations living together in the same household, which is quite rare in other states in the US. I think all these are the characteristics that could have developed an old age support system or other intergenerational transfer in Hawaii may be different from most other states in the US. Also, as for the implication of a high housing cost in Hawaii for intergenerational transfer, I would like to share what I analyzed some years ago because it was interesting to see home ownership by race in Catherine's presentation, but I also think looking at home ownership by age seemed to shed some light on the generational economy. So home ownership in Hawaii has been always lower than US average, but for the elderly population, however, they were doing quite well, at least in 2010, in home ownership. They must have played important role in asset-based reallocation funding to support their old age in Hawaii. As you can see in the left chart, the younger and the middle-aged population in Hawaii was suffering from lack of affordable housing in Hawaii, showing relatively large difference from the US average in home ownership. And the chart on the right shows how the percentage of adults living as dependent child of household, not as household or spouse of household, just living as dependent child of household has changed from 1970 to 2010. We see that the percentage increased over time for all non-elderly adults, which is probably a result of high cost of housing in Hawaii and probably the back end story of a high percentage of multi-generation household in Hawaii. So my comment or question to the presenter are, as we all know, the Hawaii is quite different from other states in the US in its racial composition and the culture. So I'm wondering whether there was any significant difference from the US average behavior found in the 2012 baseline Hawaii transfer account. And secondly, due to high cost of living and the lack of affordable housing in Hawaii, the chance of the currently younger or middle-aged population in Hawaii aging without a house or other accumulated capital seem to be much higher in the future. So what would be the implication of this for future old age supporting system in Hawaii? And lastly, it would be great if you can share your experience on which area or policy issue the transfer account have been most useful as a tool, just according to your experience. And at the state and the local government level, how the account can be best utilized. You included, Andy included in his presentation, but if you have more to add, it would be great. Before I finish, I would like to inform you that the Hawaii transfer account data and the dashboard and the developed and will finalized soon will be available on DBET website as well as the National Transfer Account website, so that anybody who needed the data can easily access. I think that's all I have. And again, many thanks to Andy and Catherine for the great presentation. Thank you.
Okay, Yang-san, thanks so much. I will actually move on to Colin's discussion, and we'll actually, give the presenters time to respond. Okay, so Colin, are you ready?
Yes, I am.
Mm-hmm.
Okay, so hello everyone. I'm Colin Hayashida. I'm one of the discussants. I think Dr. Mason and Dr. Braun has done a fantastic job in terms of providing this overview. And as pointed out, this is the first time that the state of Hawaii's government has had this kind of longitudinal understanding of the generational economy. So it's a tremendous contribution for Hawaii going forward. What I wanted to sort of comment on were not so much the data, but some of the possibilities in terms of what else can we do to prevent this situation from remaining the same or getting more difficult over time. One of the points that was raised had to do with a need to improve the environment for retirement savings. And when I think about this is with regards to the financial literacy of Americans in the U.S. right now. We have Social Security, we've got Medicare, we've got something called the IRA, individual retirement accounts. We've got things, certain words like defined benefit pensions and defined contribution pensions and Roth IRA, and anyway, it goes on and on and on, and it becomes quite complex, and it doesn't seem like many ordinary people really have any sense in understanding, and there's really a need for more financial literacy if we're going to have people begin to have some degree of control over this in the future. Related to that is even if we look at private companies that provide what is these retirement saving account plans, and where the employers provide some contributions and automatically deduct from their monthly income, that's a great thing and it's a great service, but we don't have this being offered to small businesses, and most of the businesses in Hawaii, as in most places, are small businesses. And so there's nothing right now that's available infrastructure-wise to make this possible. Question is whether or not government is to play a role, whether or not it's a nonprofit that can play a role to, in a sense, make it easier for people that are working in small businesses to begin saving for their future. Another point that was raised had to do with slowing healthcare costs, which is a huge issue. And that it's important for older people to recognize that they have a responsibility for their own health. In the U.S., 50% of Americans are overweight, 30% are obese, and people are oftentimes not complying with their doctors as far as medication is concerned. And we've got people that 50% of American older adults are not exercising regularly. So we got 20 to 30 bonus years ahead of us, and oftentimes we don't know exactly what to do with our lives. So these are issues that need to be addressed in terms of how can we provide the kind of infrastructure to assist people to live much more in a healthy state and in an engaged way, so that they live long and, well, we don't quite want to say this, but live long and die short. We don't want people to live long and die long. That basically results in an enormous amount of cost to the state coffers and the federal coffers as well. And related to that, as far as healthcare costs is concerned, when we look at our state and even in other states within the U.S., every county has what is known as a senior information directory, and these are great directories of nursing homes and Meals on Wheels and assisted living and home care, meal services, and so on. But when we look at all of this is all focused on sick care, not on well care. We need tools. We need to have a way in which we can keep older adults living long, engaged, and productive. And we need to provide them with ways in which they can do this with ease. And right now, there's nothing that is quite available. And this is a very simple infrastructural type of tool that can be developed. So, these are little things that I think that we can do, and we can create, perhaps a better situation as far as creating the infrastructure so that we don't just focus on medical solutions, but look at ways in which we can keep people that are going to be able to live another 20 to 30 more years, well engaged and continuously productive in contributing to the larger community. Catherine Braun, Dr. Braun has also given an excellent summary overview history of the background of Hawaii's multi-ethnic community. And it's a story of immigration, cultural values, income, education, occupational difference, and so on. There's really, I don't have that much to share with regards to what she's shared already. I guess the only thing that comes to my mind, and it's a concern that I have, has to do with the fact that, well, with high income individuals, they've got options as far as retirement, retirement homes and assisted living facilities. Now, low income, of course, we've got government help for nursing homes, perhaps, but state government right now is reeling right now because of the COVID-19, and even prior to that with the high costs of institutional care. But the low income basically seems to, the suggestion was need to depend heavily on family support and perhaps co-housing. With the present situation with the epidemic, we have very high unemployment, particularly in the hospitality industry, service workers. There's tremendous amount of stress on family support systems. And, there's a potential for intergenerational conflict. There's there's a growth possibly with homelessness. And the question is whether or not this will increase, and how do we resolve all of this, right? So anyway, I'll leave it with that. Thank you.
Okay, thank you so much. There are so many questions. I mean, it reminds me of this saying, there are no silver bullets. So that worked for probably US, may not work for Hawaii, and we have a very special, situation, right? So, okay, so I give the two presenters to respond to this one. Andy, you probably can go first. Are you ready, or?
Yes, I'm ready. Well, there were a lot of good comments and suggestions here. Let's see, before I go on, let me just mention that Ron Lee and Gretchen Dunhauer are here, and they have constructed national transfer accounts for the United States, and also been leaders in the global NTA project. I also want to mention that although I don't believe they've constructed complete accounts for California, they have constructed many elements of the California accounts. And these were used extensively, for example, in looking at the costs and benefits of immigration to the United States. So their work is certainly something that can be consulted. While I'm talking about Gretchen's work, one of the things that came up in Catherine's comments, which I think was very important, that talking about caregiving on the part of seniors, and those unfortunately are not included in standard economic accounts. But one of the things that we have been trying to do is to provide more information about caregiving to and from seniors and also for children. And so this is something we would love to do for Hawaii. I don't think we have the data to do that. We can do it for the United States, and Gretchen has done that kind of work. But I just don't think we have the kind of data that we need to do it for Hawaii. Maybe I'm wrong. Maybe there is good data out there that could be used for that purpose. It would certainly be useful. The other thing I want to mention is housing and co-residence. And I do want to say that when we look at private transfers, that does include the value of housing that is provided to co-resident family members. So we can analyze that. We haven't in particular. And it would be very nice to look at how that's changed over time. We hope to update these accounts once more comprehensive data is available for 2020. So we're going to be dependent on DBED for that, which is responsible for compiling that data. So let's see. Youngson asked about how the accounts for the Hawaii would be different than the US. So one difference that we've seen so far is that consumption by older non-seniors is lower in Hawaii than it is in the US. In the US, the consumption just continues to go up as people get older, even when they're in their 50s as compared with people in their 40s. And we don't see that in Hawaii, and we're not sure why. This is one of the puzzles that we want to explore. Also, consumption at very high ages seems to be lower in Hawaii than in the United States. It seems like consumption of healthcare is lower in Hawaii than for the United States on average. That's a very important issue, and so one that bears a lot of more continued careful consideration before we respond to that or think about how to what to make of that. If it holds, it's certainly a very important finding. Another thing that Young Sung asked me was how we could utilize these data more effectively for policy making and for helping it in many ways in Hawaii. Well, let me just say that the most important thing we can do is educate people about what these data are and what they mean and how they can hopefully be used by others. And Colin really reinforced this point, I think, by talking about the many institutions in Hawaii who are dealing with aging issues and about the importance of education. And so we hope that these data can be used in that way. And Cullen and other people are collaborating with us on that effort. We're just getting started on that. And I hope that we can collaborate with others. I'm not an expert on aging institutions in Hawaii. I'm learning more, and I'm very committed to trying to help people understand the kinds of things we're finding and how those interface with the sorts of things that they're learning. I think that's it. I think that's the main points I wanted to cover.
Okay, thank you so much, Andy. And Catherine, can you say a few words?
Yes, I can say a few words. Thank you very much. So this is fabulous information. I am not so familiar with the NTA project, and so I was really fascinated by seeing these graphics. I'm going to address three things. And one is data limitations. Someone sent a comment about having other data, showing other data about our Asians not living as long here as Asians on the continental US. So there are a lot of limitations, and also Dr. Lee talked about data limitations in Hawaii. There are a lot of limitations in our data when you're looking at race and ethnicity. So as you know, in the Department of Health data, we are usually, well, if you go into the Department of Health data, you can ask for data by race and ethnicity in a number of different ways. But one of the ways is just everyone gets put in a group. We tried to minimize the mixed race group because it's not that meaningful to us if you're looking at culture and history and the effects of culture and history on behaviors and caregiving patterns and so forth. So that's very interesting, but as you know, we tend to not put anyone in the Hispanic group. We tend to put people, if they have one drop of Native Hawaiian, in the Hawaiian group, even though 99% of Native Hawaiians are going to be mixed race. So it's hardest to be a Caucasian, and so, you know, in the end, by the way that the Department of Health, by the way, I get the data that I like the best from the Department of Health, which maximizes the number of Native Hawaiians and minimizes the number of mixed race people. We know that many of those are mixed race, and those people would be classified differently if our raw data were sent to another state. We may end up having 30% of our population being Hispanic or something, because they might count Portuguese, anyone with Portuguese ancestry. So you could see how there are lots of limitations in working with race and ethnic data. That said, it would be very interesting to see if the transfers are different by race and ethnicity in Hawaii. I don't know. I don't want to make any more work for you, Andy, because it sounds like this one was hard enough. But that would be an interesting thing for me. The second thing is housing. We have a housing crisis. I did appreciate the data on housing by home ownership by age. I do think that's true. The older people have housing, the younger people do not. There have been studies, just read a study from England that shows that young people in England are very dependent on living with parents longer and getting cash from their parents to secure housing. And I think that is going to become more and more true here in Hawaii. I have done some research with Native Hawaiians who have emigrated, who have left Hawaii and gone to other states. And the number one reason is housing. Lack of ability to have a house here. Second reason is lack of jobs here, or lack of jobs that pay well here. So I think we may see more immigration and of people that cannot afford to buy housing here. And if they can never afford to buy housing, we'll see a lot more people then tapping into Medicaid as elders. Policy implications. I really appreciate how all of these can be all of these data can be used to influence policy. Totally in support of having a higher minimum wage, but I don't know what is going to be possible now with the recession stimulated by COVID-19. So these will be interesting things to watch. And I know that your data will have a big impact on how these decisions get made. So thank you.
Okay, thank you. Thank you very much. So we have time for a few Q&A. So you can just actually unmute yourself and ask questions here if you'd like to ask some questions.
I was wondering, and it's probably a question for Andy, but if in the sort of challenges that the state of Hawaii is going to face fiscally, is Hawaii one of those states with those scary sort of invisible unfunded liability for public pension programs hanging around, or is that at least not on the future problems list?
No, we have a very large unfunded liability for public workers. The state was working very hard to reduce the size of those unfunded liabilities. So they've been making a lot of extra contributions to those funds. So now with COVID-19 and they're looking everywhere they can for money, I fully expect that they will stop making extra large contributions, and they may in fact increase the liabilities, unfunded liabilities. As someone who depends on that for my living, I hope they continue to strengthen the system. But on the other hand, this is a crisis situation, so maybe that's something that's a good idea for a couple of years. For the longer term, no, this is certainly an issue that we're trying to address in Hawaii, and it's important.
Okay, any other questions?
I have,
Yeah.
yes, Sonia, I have also a question for Andy. I was wondering, what is the situation on transfers, public and private, between Hawaii and the rest of the USA? Is Hawaii net receivers of public and private transfer?
So we probably don't have a good idea about private transfers. So there's just not very good data, I don't think, on that. Public transfers was surprisingly difficult to look at.
Okay.
You would think it would be pretty easy. We thought it would be. There's been a lot of different estimates about, for example, how much Hawaii is paying in taxes, and then there's also different ideas about how much we're getting in benefits. So we do know about Social Security and Medicare very well. When it comes to in-kind transfers from the federal government, we're assuming that we get the same amount as everybody else in the country. So national defense is just as valuable to us as it is to somebody who lives in Maine. And we do have, I think we have a good handle on how much tax payments are from Hawaii residents. We're not either, you know, we pay about our fair share, I would say. Where Hawaii is not a particularly old state. People think it is, but a lot of people leave Hawaii when they get older. And so our public inflows from the US are not terribly high. That may go up in our projections. the number of people 75 and older is expected to increase in Hawaii faster than in the rest of the country because of our high survival rates. So we may start being net beneficiaries of Social Security and Medicare in the future. But right now it's sort of fairly even.
Thank you.
Thank you.
Okay, so we may have a time for just one more questions, if you have one. Going once, going twice. Okay, so I actually found that 60 people actually stayed in the participated in this session, and right now it's still 55. It's just amazing, and I can see actually so many people from Europe, which is like 1 a.m. also listening to this presentation. So I think Catherine, Andy, you are very popular. I cannot have this big crowd. So again, congratulations on your presentation. And let's have lunch. I mean, I'm talking to Hawaii people, okay? Let's have lunch and get back to our later sessions. Thank you very much.